Hi, this is Dr. Anthony Markiewicz of Markiewicz Dental with all the concerns about coronavirus. We wanted to give you an update of what we're doing to prioritize your safety. At Markiewicz Dental, most of you know that we're constantly trying to incorporate new technologies and new procedures into our practice. We often have team meetings and reassess where we're at with the practice, and sometimes it's the boring things that we don't talk about, like looking at our infection control practices. In our office, basically what we do is if we try and heat sterilize everything in an autoclave, we have a highly technical instrument washer which cleans and dries the instruments before everything is heat sterilized. If something can't be heat sterilized, we try and use it as disposable. If something's not disposable, we use a barrier on top of it. All of our surfaces are heavily disinfected with a medical grade disinfectant. The chairs are wiped down, barriers are changed. The team follows good hygiene, utilizing protective barriers, gloves, masks, glasses to try and ensure patient safety. We do the most that we can to try and provide, and we follow all appropriate guidelines, and we exceed mostly what's expected of us. We've always followed really good infection control practices. We've reviewed our protocols. In lieu of what's happening, we've made a few tweaks here and there to our infection control practices, and here's some of the things that we do on a regular basis. Number one, upon reviewing our infection control practices, we notice that we reuse protective eyewear. Eyewear is important to protect our patients' eyes from any splatter. We've always used really nice safety glasses, which we disinfect in between patient use. We kind of looked at that. If we're not supposed to touch our hands to our eyes, our nose, or our mouth, we don't want to put reusable glasses on you. So if you come to our office and we're going to do dental treatment, please either keep your own glasses on to protect your eyes, or we'll give you a pair of disposable safety glasses to use. Number two, we're going to really encourage people to practice respiratory hygiene. If you have a cough or a sneeze, and everybody coughs and sneezes once in a while without being ill, we're going to request that you use disposable tissues. We've installed in our waiting area touch-free hand sanitizers. We will have tissues and we have touch-free receptacles. So we're going to ask that you, if you're going to cough or sneeze, to please use disposable tissues, dispose of them in the trash can, and then use hand sanitizer. If you don't have a cough or sneeze, we're going to ask that you hand sanitize on the way into the operatory and also hand sanitize on the way out. Number three, it's patient screening. It's one of the things that's recommended. It is cold and flu season. The odds of actually acquiring coronavirus at this time is fairly small. Also, if you are a healthy or younger individual, the odds of actually knowing that you contract coronavirus is small. About 5% of the cases are more critical and require medical attention. But what we're going to ask is if patients have either a fever, a cough, or have any sign of illness in the last 14 days, we're going to ask them to reschedule. That's both to protect you, the patient, and also protect other patients. Thank you so much for trusting us with your care. Thanks for taking your time to watch this. We promise to remain vigilant. We'll keep you updated if there's any changes, and we will also be vigilant to see if there's anything else we can do to make sure that we ensure your safety.